Hello, everyone. Welcome to the Employer COVID-19 Vaccine Symposium. We will be getting started momentarily. We're going to let all of our participants join the webinar. Hello, everyone, and welcome. I'm Kimberly Grantham, Senior Director of Corporate and Foundation Relations at the University of Memphis. We are so thrilled to have you joining us today. A couple months ago, the U of M team and the Greater Memphis Chamber team came together with the hope to provide our employers with solid information surrounding the implementation of the COVID-19 vaccine and how to ensure that our Memphis business leaders are armed and informed and good and accurate decisions when it came to the vaccine and their employees. This is a three-part series. So 2 weeks ago, we shared with you the overall sentiment towards the vaccine through a survey of local employers and employees. During that webinar, we also shared with you fact-based information surrounding the vaccine. So today, we are delighted to have one of our major employers, International Paper, share with you how they are communicating with their employees and actually providing the vaccine to their teammates. We will also hear from Fire Director Gina Sweat, who is leading the charge on the vaccination for the city of Memphis. And of course, my good friend Bobby White, Chief Public Policy Officer for the Chamber, has been keeping tabs on what's happening in Nashville and the potential legislation that could impact the businesses of Tennessee as it relates to the vaccine. And finally, this is meant to be interactive. We want you to ask questions so that we can provide answers for you. So I encourage you to submit your questions through the Q&A feature at the bottom of your screen. And now, without further ado, it is my extreme pleasure to introduce you to the amazing Helen Grant. She is the Communication Manager, Enterprise, Operational Excellence for International Paper. Helen has been on the front line communicating with IP employees and assisting in vaccinating over 300 of her fellow team members. Helen, the floor is yours.
Well, thank you so much for having me today. That was quite an introduction and far more than I deserve. So it's great to be with all of you, and I look forward to hearing what others in the community are doing as well. My team, we're a tiny team of two, manages communications for all the staff groups that support our mills and container plants. We're based here in Memphis. And so that so happens to include environment, health, and safety, which is how I ended up leading the charge for communications related to the COVID-19 pandemic. And I'm probably like many of you, this is great experience, but I hope never to repeat it. So flashback to December 2019, when I got an invitation to attend a pandemic team meeting. I knew we had this team, but I never thought we would actually convene, but off I went. I'll admit, I left that meeting thinking there was no possible way a pandemic in China was truly going to affect us. But as the frequency of those meetings began to pick up, I quickly began to understand that we had a very serious global health situation to deal with. Then in March 2020, we were told to begin working from home. And like many of you, I thought we'd be there a couple weeks, but now, well over a year, I'm still primarily working from home, but feeling fortunate to have that opportunity. And I'll be honest, I really didn't know where to begin with COVID communications, given that no one had ever experienced anything like this before. The safety of our employees is our #1 responsibility at International Paper, so their health and well-being was a natural fit of being part of that safety focus. So I feel like in March 2020, we were forced into a reactive communication mode, which wasn't ideal, but that's how it started. Initially, our focus was on remote working, the redesign of jobs at our facilities, and implementation of COVID-19 policies and procedures at every single one of our locations around the world. In the United States, that means that we're trying to align as closely as possible with guidance from the CDC, but of course we also have to follow what is required by OSHA. Usually that goes hand in hand, but we have to keep an eye on both. So for our Memphis group here, it was kind of like flipping a switch. We have approximately 2,500 team members here, and most could easily make the shift to work from home with no issue. For the handful that couldn't, we were able to work through that and make it possible for them. We have a world-class IT organization who didn't miss a beat helping that transition, and it really felt seamless. The bigger challenge for many of us was suddenly working from home with children and spouses in the mix. I now share a dine office with my husband, and we have 3 children. So I think that's the bigger challenge for those of us who are able to work remote. But however, for our mills and container plants, it wasn't so easy. We're an essential business and still had customers to take care of, many who were also essential businesses. So remaining operational was absolutely critical. Many jobs had to be redesigned to allow additional PPE usage as well as social distancing. And the good news is our efforts there worked. We have no cases of workplace transmission in Memphis, and we believe there to be very few, if any, at our facilities. Our transmission rates have typically mirrored community transmission rates. So the close contact process and all the procedures we've put in place have really kept our workforce healthy. So we'll kind of call that phase 1, our reactive phase. And once we got that rolling, our phase 2 of communication really focused on education. Vaccine wasn't available yet. We didn't know when that was coming. People were overwhelmed and thinking about how long this could last. So my team was tasked with putting together a lot of information based on CDC guidance that could be shared in channels such as our electronic company newsletter that runs a couple of times a week, our internal IPTV system, posters, one-pagers, lots of things that we tried to put into the hands of our frontline leaders and managers to share with their employees, just to help them understand really how COVID-19 was transmitted and what they could do to protect themselves, and how all the reasons why it was so important for us to have all of the policies and procedures in place that have been newly implemented. We put together information that employees could share with their family members about taking those best practices learned at work and applying them at home. We sent out reminders during the holiday season, focused on how you could stay safe and healthy during the holiday season and what was recommended by the CDC. And while all of this was taking place, our facilities were also really working hard to pull together pandemic preparedness plans that reflected all that was in place to keep our employees and contractors safe from COVID-19. So phase 3 was when we really began to focus on education and benefits of the COVID vaccine, as well as staying the course with our policies and procedures. This is the point where frustration and fatigue and just a desire to return to normalcy really started to kick in, and it was hard. People were, of course, understanding and as cooperative as possible, but by then you're really tired of wearing your mask. And as a communicator, I wanted to roll out a huge splashy campaign, but after a lot of conversation with our senior leadership, our HR group, our legal team, we understood that we really needed to be cautious. It's an emotional topic for everybody. Health information is private, and we needed to ensure that we really were not creating a divide in the workplace, that we needed to recognize there could be religious beliefs or personal health reasons that could prevent an employee from becoming vaccinated. So we decided our approach should be education and encouragement. So we continued to really educate about fact-based information, but also encouraging employees to begin considering the reasons they should get a vaccine. We knew they were in development, and again, we wanted them to have factual information, not myths. We created toolkits that pointed employees to resources like the CDC and other health information, encouraged them to talk to their personal physician about educating themselves about the benefits of getting a vaccine. And of course, that begged the question from employees whether or not we were going to require vaccination. So we had to address that. Our decision was no, we are not going to require them at this time. but we strongly encourage our employees to receive one when eligible and available. So then we began to look at eligibility requirements by state, at least here in the United States, and understanding what groups of our employees could potentially get one and where. Our next phase, what I would consider phase 4, which is where we are today, continues to be focused on how to connect employees to a vaccine and emphasizing that now is not the time to roll back any of our policies and procedures related to COVID-19. Vaccine rollout, as you know, began in December. So now the challenge became how to connect employees to one if they were willing to receive it. So we put together a guide for facilities that outlined how they could go through a process to become a point of dispensing if that was an option at their site. And we pointed to resources here in Memphis that could help employees locate a vaccine available to them. And that included sites like vaccinefinder.org, for example. In Memphis, that meant that we were able to host on-site points of dispensing clinics, which is why I'm here in the office today. We've got one going on right now. We were able to secure a partnership with Methodist Hospital, which enabled us to gain access to the vaccine, which ended up being Pfizer. We're very fortunate that here in Memphis, we have 13 amazing occupational health nurses that can administer vaccines. So they went through some training to be able to do that. And we've hosted 3 pods so far. Our 4th is going on right now. And by the end of the day, assuming all things go well, which they have at all of these, we'll have given about 900 doses. So most of these are round 1 shots, a handful of second shots, and we'll continue to host pods to ensure our employees that got their round 1 vaccine through us can also get their round 2 vaccine through us after 21 days has gone by. So we're pleased with the uptake rate in Memphis. We don't have all the data yet, but it appears that a large percentage of our employees here have had at least their first vaccination, either through our on-site pods or elsewhere within the community. So we're optimistic that encouraging employees will continue to drive that success. And our next phase, and hopefully final phase, will just be focused on the shift to return to work plans for our Memphis office. And we have a team that's looking into that right now. I am not on it. However, I do know that they're looking at a few factors or many factors that you guys are probably looking at as well. What are our capacity restrictions? Can we use a hybrid approach? How flexible do we need to be with working parents given the fluid school situation and what they have to do to take care of our children? Daycare options, what is that looking like, and how are we going to set those parents up for success? And then finally, what's the comfort zone of employees coming back to the office? That's going to vary. Some are going to be all for it. Some are going to be a little nervous and apprehensive about it, understandably so. So how are we going to set up the return to make everybody feel good about it? And I might be the person who's ready to run up and give everybody a great big hug, and some people may still want their 6 feet. So we're trying to think through what that might look like. So our focus really is education, encouragement, and linking our employees to vaccine. So I don't know if you want me to take questions now or just wait till everybody's presented.
I think that we'll wait until everyone has presented. And everyone, remember that you can submit your questions for Helen in the chat area, and then we will have Matt McDaniel come on at the end of our webinar and facilitate some Q&A. So Helen, you'll probably be called on to come back on the screen. But thank you so much for all of this fantastic information. We really appreciate all that you're doing to vaccinate people in Memphis, and all of the work that you and your team have put together to make it happen. So thank you so much. And now it is my honor to ask my colleague and friend, Bobby White, Chief Public Policy Officer, to join us to make an update on legislation that is being discussed at the state level. So Bobby, I'll turn it over to you.
Thank you so much, Kimberly. I truly appreciate the opportunity. Kimberly and the University of Memphis. You guys have been great partners to us here at the Chamber. I'm actually here at the Chamber office. This is actually not a background here in our conference room here at the Chamber. We, like so many individuals, have been working remotely and working quite hard remotely during this pandemic. And so visiting the office during this time is rare, but it is a joy and opportunity to be back downtown. I wanted to just actually speak regarding some of the work that the Chamber has been moving forward with as it relates to this pandemic. In my work in public policy, we have been very attentive to legislation happening there in Nashville and how it might have implication for our businesses, our industries here in Memphis. And so we've been working with chambers from across the state, our friends with the Nashville Chamber, Knoxville Chamber, also the Chattanooga Chamber, in addition to about 7 other chambers that we built out to that represent communities across the state in terms of paying attention to those pieces of legislation that might be of particular interest to our business leaders. One thing that we played a critical role with, working with the Tennessee Chamber, our chamber and the Nashville Chamber were the only 2 chambers. There were other business associations, and along with the Tennessee Chamber, we worked together regarding pandemic liability protection, because there was early on an interest, and should say a concern regarding the litigious nature of how this environment could play out and how our business leaders could, in fact, find themselves on the wrong side of frivolous lawsuits. And so we found ourselves in that position. So right now, we're in the middle of legislative session there in Nashville, and there, outside of the bills that have been introduced, there were 1,000 of them, to be quite frank with you. We've whittled down to a few of them that are still ongoing, that we're still looking at their impact, that could have impact for our business leaders. And I wanted to just mention those very briefly. There is Senate Bill 187, House Bill 13, same bill. It is in the healthcare, it prohibits mandatory COVID-19 vaccinations. And this is coming from Senator Janice Bowling and Representative Bud Hughley. And it prohibits state and local authorities from forcing, requiring, or coercing a person to receive an immunization or vaccination for COVID-19 against the person's will. I want to in particular say that the forcing and coercing, you heard those words, but requiring is a word that is of concern. So it is prohibiting state and local officials from requiring a person from receiving immunization or vaccination for COVID-19 against that person's will. Right now, as of a few days ago, that is in the Senate Health and Welfare Committee and recommended for amendments that we will be seeing coming up from that Senate Calendar Committee. We're looking for more information to come up, and there's no fiscal note attached to this, meaning that it would not necessarily cost the state. There's also Senate Bill 564, House Bill 1269. The companion in the House is 1269. It is a healthcare bill that creates a civil cause of action for discrimination based on COVID-19 vaccine status. The summary is that it creates a civil cause of action for discrimination on the basis of an individual's COVID-19 vaccination status. And establishes a $1,000 fine for the first act of discrimination, $10,000 for the second act, and $750,000 fine for the third, any subsequent acts of discrimination. Specifies that any remedy for discrimination under this cause of action does not prohibit victims from seeking other remedies available under the law. And it is broadly captioned. Right now, it was taken off of notice as of, on the House side, it was taken off of notice in the House Civil Justice Subcommittee. But on the Senate side, it is set for a Senate Judiciary Committee on the 13th, which is in just a few days. Lastly, is probably the one that is most concerning to many of us as we have looked through information that we've seen. And again, when you're going through these processes, so many of these pieces of legislation are introduced and they don't see the light of day for whatever reason. there isn't a consensus. They fall off of the map. But this is one that is still moving forward. And it was concerning to us because medical device, and I'll mention to you what it is. It is Senate Bill 320, and the companion in the House is House Bill 794. And it is discrimination of person wearing or using a medical device. I should mention to you that from the onset, the concern was that medical device also covered face masks. And this is what it does. This is from Senator Joey Hensley and Representative Susan Lynn. It prohibits a person from denying an individual the full and equal enjoyment of goods, services, facilities, privileges, advantages, and accommodations of a place of public accommodation, resort, or amusement on the grounds of the wearing or use of a medical device or whether the individual has received medical treatment. So it may sound harmless, but the issue was the wearing of a medical device. It basically challenged the ability to deny a person access to services based on them wearing or using a medical device. And the concern was medical device could also mean face masks. I do want to make aware that this is now being looked at. The Senate Commerce and Labor Committee have deferred it to the next calendar. I also want to mention that as of very recently, there has been an amendment. It was recently amended so that it no longer applies to face masks, but does prohibit a business from discriminating based on vaccination status. So that's where we are. So the hardest part of that, we were able to duck, which was potentially businesses not being allowed to deny individuals access and use of services based on them wearing a face mask. So we're able to get over the hump, but we are still watching very closely. And let me just say, the fact that I only have 3 pieces of legislation, potential legislation to mention, speaks to the way this process works, because there have been so many others, scores upon scores upon scores of pieces of legislation, and we're down to these 3 that we're watching very closely. So those are the things that we are updating our businesses regarding, and the outcomes of these will be shared out more broadly. And just wanted to appreciate you all for being concerned about getting vaccinations done at your respective places of employment, your respective businesses. That's all I have. Thank you all very much. Thank you, Kimberly.
Well, that was excellent, Mr. Bobby. I appreciate you sharing that.
Thank you, Matt.
It is my pleasure to be able to introduce Director Gina Sweat, the Director of Fire Services for the City of Memphis. She's in her 29th year with the Memphis Fire Department beginning on May 26th of 1992. And as a firefighter, she was originally assigned to Snorkel 2 at Fire Station 1 down on Jackson Avenue, I believe. She later transferred to Engine 1, where she remained when she was promoted to driver on July 5th of 1995. She was then promoted to lieutenant in March 10th, 1998, and assigned to Engine 5. And then in May of 2001, she was promoted to battalion chief, assuming command of Battalion 4, which included 5 downtown fire stations. And then in August of 2008, Director Swett was promoted to division chief at the time and assigned to fire administration. In that role, she collaborated with the fire department command staff, as well as other city divisions regarding operational issues, staffing, disciplinary actions, budgeting, and strategic planning. Then in July of 2014, she assumed the duties of the Deputy Chief of Logistics on an interim basis. In this capacity, she was responsible for the Logistics Service Center as well as the Fire Communications Service Center. And then on January 1st of 2016, Director Swett was appointed then as the Director of Fire Services. She is the first female to serve in this capacity in the history of the Memphis Fire Department and one of only a handful of females leading a metropolitan fire department in the United States. Director Swett credits her success to her parents for instilling the value of hard work and determination in her at a young age. She was a Lion at Freed-Hardeman University over in, Hendersonville, where she earned a Bachelor's of Business Administration degree in marketing in 1998. She also played collegiate basketball while she was there at Freed-Hardeman. And her career statistics were 644 points, 308 rebounds, and 154 assists, it looks like. Then after joining the Memphis Fire Department, she continued her education by attaining a Bachelor's of Professional Studies in Fire Administration in 2000, and then a Master's of Professional Studies in Strategic Leadership in 2013, both from the University of Memphis. Go Tigers. Director Swett, the floor is yours.
Thanks, Matt, for that introduction. I think they may have over-exaggerated my number of assists there because I don't remember having that many. I did like to shoot, but thanks for having me today. It's a pleasure to be able to talk to the members of the chamber and talk about our best shot to fully get back to business. And I think everyone's probably seen our city logo, our best shot, and vaccinating the public is not what I normally do. That's not my daytime job, right? We still are putting out fires and we're still responding to a large number of EMS calls on a daily basis. And COVID has definitely impacted the fire department. But when the city was asked in particular to step up and take over the vaccine administration, the Memphis Fire Department we were ready to take on that challenge. And that's one that we embrace. There was some proactive work that was done to put us in position to be able to accept and manage the vaccine, which I heard them speaking about earlier. It's a very complicated process, so it's not just as easy as giving somebody a shot. The vaccine is very complicated to manage the inventory and to distribute it properly. There's a lot of cold storage requirements that have to be met, and so your Memphis firefighters are the ones that are doing this heavy lift as far as managing the vaccine and making sure that we have no doses wasted in our county and that every shot counts and it goes in somebody's arms. So I'll start off with business owners. I'm sure numbers are important to all y'all, so I'll just go over some data, just some basic data. To date in Shelby County, we have 394,328 doses have been administered in our county. And that's pretty incredible. That's showing almost 15% of our population has been fully vaccinated and close to 28% has been partially vaccinated. Now, that's a long way from the herd immunity number that the epidemiologists say that we need to get to 70% of our community population to really get a good herd immunity. So as you see, we have a long way to go. And I'm hoping that this group can help us get there so that we can get back to business. That number is 254,331 people have been vaccinated in Shelby County. Now, I do realize, we have, it's not just about Shelby County because our surrounding communities also, they recreate here in Memphis. They work here. A lot of them work here. They travel here. They shop here. So they also could bring COVID here. So we want to, this is definitely a regional effort. We want to make sure that the entire community around us also has opportunity to get vaccinated, and that helps all of us here in our city. A couple of staggering numbers. We've had over 92,000 cases of COVID in Shelby County and 1,575 deaths since March of last year. That's, heartbreaking numbers that people have actually lost their lives. But our goal now is to get as many people vaccinated as quickly as possible so that we establish that herd immunity and hopefully reduce the chance of people losing their lives. So how do we do that? And how can you help? So many of you may have heard about the FEMA is in town, and we did not invite them to town. They asked us if they could come in town to help us with the vaccination process. We had a pretty efficient operation going on at the Pipkin site. It's located in the center of town. We were administering anywhere from 12 to 1,400 doses of vaccine there a day. And we had reduced our wait times, which was one of the major complaints that we first encountered there, to less than 12 minutes. So it runs anywhere from about 8 to 12 minutes now. And that's pretty remarkable. We did that by putting in some processes. And so the wait time should no longer be an issue. Quite honestly, anybody in Shelby County that wants to get a shot can get a shot. We have appointments still available this week, and lots of opportunity out there for appointments. And we're doing that. We have 6 sites now that are open different. Some of them, they're not open 6 days a week, but we have at least one site open every day of the week. And the Pipkin site's running 12 hours a day. So there's plenty of opportunity there to be had. The second thing we did was prior to the FEMA group coming to town to help assist us, we had started reaching out to the community for community pods. And what we were doing, we looked at the data, which is something that we do here regularly, not just daily, but every hour we're looking at some portion of data trying to figure out how to make this process better. But we looked at the data where we had the low uptake of vaccine, and we specifically targeted initially the faith-based communities in those areas and started doing some community pods. Now, that's a very targeted approach, but it's also pretty labor intensive. So now we have this mass vaccine site. We have the capability to deliver, we got an additional 21,000 doses of vaccine a week. That was on top of, we had ramped up, we were already delivering somewhere between 32 to 34,000 doses a week at all of our other sites. So we have over 53,000 opportunities for people in this community to get vaccinated each and every week. So as you see, there's no excuse not to get vaccinated. So now, how do we get people to the Pipkin site? And that's where I'm going to ask for your help today. We've worked with the school systems. We've worked with the colleges to try to create some ways for the students to, have events where they can come get vaccinated. So that's good. So we were talking and we decided, how can the communities, your employees, and I know the great work that IP is doing, that's incredible. But every employer doesn't have, that kind of staff or that opportunity. So we've created a fast lane or HOV lane, ever how you want to call it. So people that want to schedule a block of appointments or bring groups in a van or a 15-passenger van or a small bus or something like that, we can do that. We can set that up for you, and you can make it a fun lunch event. Take 10 of your coworkers, go set up a bank of appointments down there, and we'll get you in and out through the HOV lane and get you back to work. We're also in the process, and there's a process to set up. If you want to bank a set of appointments for your business only, do you want to take, we have the ability to do 250 shots in an hour. So if you would say you wanted to schedule from 8 o'clock to 9 o'clock on, just say Saturday morning, then you will call the helpline or email the helpline. We will get back to you, we will work with you, and we will block off that set of appointments for your business between 8 and 9 on that morning if you have 250 people. That way you can tell them on your way to work, go through and get your vaccine. Now we think this is going to be like a concierge service. It's going to get our community vaccinated. It'll especially allow you as an employer or a business or a nonprofit in our community to get your workers and your employees where they have that herd immunity in your offices. And then that way we can get back into the offices, get back to work and get back to business. So those numbers, I'm going to go ahead and give you those. We'll be sending out a pamphlet that has that information on it, but I'll just give you that now. The phone number that you call is 901-636-VACU, VACU, or 8228. That's 636-8228. Our helpline, our help email address is COVID-19help@memphistn.gov. You can contact either one of those numbers and they will walk you through the process of how you can either book a bank of appointments or how you can set up someone for it to come through the HOV lane. And then this is in addition to people, our regular website information. Anybody that wants to schedule an individual shot, they can still go to the COVID-19.memphistn.gov, or they can call the 901-222 shot number, and that's just for individual appointments. But we wanted to set up a process where we could get groups, employers, or different organizations could bring a group or a block of people out there at a time. So hopefully this is going to be, get more people out there, get more people vaccinated so that we can get fully back to business and get our city back to somewhat of whatever the new normal is going to be. So I know that I'm ready to get back to my first and primary job, which is fighting fires and responding on EMS calls. But I just want you to feel confident. I think the Memphis Fire Department has a lot of respect in this community. I think people trust us. And I just want you to know that we're going to get this done as efficiently and as quickly as possible. But we do need your help to get people out there and get the vaccine uptake up. So with that, I'll stand by for any questions.
All right. Thank you so much, Director Swett. You were right. I've worked with many of your staff over the past few years, and I worked in public health emergency preparedness, and they were always fantastic to work with. If you don't mind, I know that you didn't touch on this just yet, but I believe they just spoke about this. The city just spoke about it today about homebound vaccinations. Could you share anything about that? Just a moment or two.
Absolutely can. Actually, that's something I'm really proud of. The Memphis Fire Department, you may have seen over the past few years, we have a group called the Healthcare Navigators. Now, part of their job is to provide a different approach to either people who overuse 911 or call and don't actually have a life-threatening emergency, but just need some access to the medical field, maybe a primary care prescriptions or just a lot of different things. So the Healthcare Navigators have teamed with other organizations, other groups in the city, specifically Meritan, and we have what we call the Community Vaccination Unit now. And they actually are delivering vaccine to homebound individuals. There's a link on the city's COVID-19 page to register if you're a homebound individual or if you have a family member who is homebound. So they can go there and register, or they can call the 222 SHOT and give them the information. And someone from the Healthcare Navigator program will contact them to make sure they meet the criteria and will arrange to come out and give them a vaccination. This unit is also working with people experiencing homelessness in our community, and they set up several small events at some of the places where the people experiencing homelessness are, sometimes where the feeding places or the where they reside sometimes at night at some of the missions. And to date, they've administered 250 vaccinations to that community. It's about getting out to the entire community. And that's what I feel like our role is in the vaccination process. We have built a system that will be able to deliver the vaccine. So if there's an obstacle, if there's a barrier that's preventing you from getting to the site or to get to a place to get the vaccine, that's what we need to know about so we can remove that barrier, remove that obstacle, and make sure that our entire community has an opportunity to get vaccinated.
That is great. Thank you so much for sharing that. I got one, everyone, before we really jump into it, don't forget to type your questions into the Q&A box and we'll go through them and get the right person on the job for that. And one of the first questions, just to get out of the way, what was that number that employers could call to set up appointments? Somebody was asking if you could repeat that.
Yes, that number is 901-636-8228.
901-8228. Thank you so much.
And then also, if no one answers, because that'll just be regular business hours, you can email 24 hours. That's COVID-19help@memphistn.gov. And then someone, if you leave a message there or just give us the details of what you need, then someone will get back.
Gotcha. One of the other questions we've gotten was, one of the attendees noticed it was announced today that they were accepting individuals without appointments. How long do you see that continuing?
So that's been a question of a lot of debate. As I explained earlier, the process is especially managing the vaccine is quite complicated. From the time it's frozen, once it's thawed out, we have 5 days to use the vaccine. But once it's drawn up in a syringe, we have 5 hours to use the vaccine. So we have to do that just in time drawing of the vaccine on site and delivering it on site to administer the vaccine. So what we're trying now, because we have a lot of capacity left in our system at Pipkin, between the hours of 5 in the afternoon and 8 at night, we're going to take the first 500 people to show up without an appointment can come to the Pipkin site only and get a vaccine. 501, you're out of luck. But the first 500 people, we will, without an appointment, can show up and get a vaccine. We're going to do that starting today and through the rest of the week to see what type of response we have there. We do understand there are some people that have busy schedules and they may not really know when they want to make an appointment, but they still want to stop by and get a vaccine. So that's just one of our efforts to make sure that people are getting vaccinated. And if I could, I would like to just add one thing, because I think it's important to this group. It's wide open now for people 16 and up to get vaccinated. I think it's really important that we reach out to the younger part of that spectrum, because their parents have to be with them to get vaccinated if they're under 18. But I think it's important for them to get back to school, to get back into sports, to get back to hanging out with their friends. And someone said something yesterday that just resonated with me. She's been talking to her son, who is in college, about over and over and over about getting the vaccine, and he never did it. So finally, she just made the appointment for him. So, I challenge those out there that have, children or children, kids in college, to think about that. You can tell them, but sometimes you just got to grab them by the hand and make sure that they get that appointment made and see it through.
You were so right. And it's almost like you set it up right there. I got a question asking if there's any plans for setting up, some sort of small pods on the college, university campuses in the area to try to get those 18 to 22, mid 20-year-olds on a higher rate of vaccinations.
So originally we've reached out to the colleges, and the request, quite honestly, Christian Brothers is right across the street. So it actually logistically, it just takes a lot of resources to deliver a pod to a facility, when it makes perfect sense for us to set up blocks of appointments for them to come out on site at Pipkin. I think the Pipkin site is very close proximity to most of the colleges in our area. So I think it's it'll be better for us to set up either those blocks of appointments. We've had discussions about having a Greek day or having some contests between the schools. I know the University of Memphis has already put out some information to all their students about being able to come to site. I don't see, while we still have this massive opportunity here in the center of our city, I don't see us being able to deliver on campus pods at this time. But we are willing to work with any college group, any college of the teams or any of those to set up those block of appointments and get them in there on the fast track.
Thank you so much for your answer. I appreciate that. Makes sense to me. I got mine over at Raleigh, and it was a very easy process, very little wait, and, sat in the parking lot for a little bit, and then we're just back off and running. So it was great. The only problem is I think the guy put the entire needle and half of it in my arm, but it was fine. It went on in.
It's experiences like that. That's what we need. We need that, to resonate with the public. The big thing is it's not that painful. It's just a little bitty needle. And the main thing is the wait times. We've resolved that issue at all of our sites. We don't have huge wait times. We measure it every day. It's about 12 minutes average now. Hardly ever over 20 minutes anymore. Of course, there are, and I think that's important. You can get in and out a lot faster than you can go to your doctor's office, probably. So, take advantage of that opportunity and let's get Memphis vaccinated.
Yeah, the only holdup for me was the car in front of me in the tent died. They had to push it out. That was the only bump in the road. Other than that, it was just snapped it right out. And let's see, Helen and Bobby, if y'all wouldn't mind hopping back on too. I think we've got a few questions that came up for y'all as well. Let's see. Helen, we had some people asking how many of the offices and sorry about that. Are the vaccination pods available at all sites or only the corporate location on Poplar?
It depends. We have about 375, 380 locations globally. So obviously, when you think about here in the US, all of our facilities received guidance on hosting a pod, and they kind of outlined what the requirements would be, what the training requirements would be for an on-site health nurse there, refrigeration requirements, everything that would be required to host one, additional PPE. And some sites very easily had those capabilities, as did our corporate office here in Memphis. So it was easy for us to stand that up, and it's been easy for many of our locations to offer that. However, some sites don't have occupational health nurses on site. We've directed them to partner with their local health departments and others in the community, whether it's a hospital or the local health department, or maybe a third-party provider that can come on site to do that, or direct employees to where they are available. We just don't ever want to have a situation where an employee comes in and says, where can I get one? And there's not an answer. We should always be able to direct them to where it's available within the community if they don't have an on-site pod. So it's going well so far. We'd like to see our facility uptake rates become a little higher, but it's still early in the process yet. But we've had a good response where we've been able to offer on-site pods.
That's great. Thank you so much, Ms. Grant. Here's a question I think can go out to Director Swett and you as well. It's amazing. Somebody's asked, I think it's an amazing incentive to offer the vaccine on site, but have either of you considered any incentives for employees to get vaccinated? I guess like a tangible good or something like that to get a bigger uptake?
Well, I can say this is Director Swett. I can say the city of Memphis early on, first responders were some of the first groups that were approved to get vaccinated. The city did offer $50 gift cards for fire and police once they received their second dose. And I think it was a nice incentive. It did help a little bit, and we were able to get, because at first the percentage of our employees that said they wanted to get vaccinated was a little lower than we had hoped, and we were able to get our number up a little bit after offering some incentives like that.
Here we have not offered any cash incentives or any other tangible incentive. We've just focused on education and connecting to a vaccine. So we keep evaluating that, but at this time we haven't offered anything additional.
I will, Matt, I'll jump in there. I will mention that one of our chamber members, and we've seen bits and pieces of it, and depending upon, employee, the sector, the industry, number of employees, but we did see AutoZone actually offer $100 for employees who receive the COVID-19 vaccine. And we know that's no small stretch given their size. But again, it's been one of those things, to Helen's point, where people are making decisions at their level, what is working. And when they're seeing that things aren't necessarily getting them there, you kind of see some of the incentives being thought through on what they could do more to incentivize people actually getting those shots.
That's great. Thank you, Mr. Bobby. I appreciate that. Thank y'all all for sharing, actually. And we've got time for one more question. I'll throw this out here to the group. If you've got employees with a vaccine hesitancy, we've talked about education and all that. Who do y'all consider to be the best authoritative resource who they could refer employees to try to get over that bump, I guess you could say? And
I'll jump in. I'll bite. So I would say this, that of all of the things, the best people are the closest people. You're finding that the vaccine hesitancy, those numbers are going back down. We were, especially in Black and brown communities, the number was a little higher. And I would tell you, I don't think those are coordinated campaigns from the CDC or National Institute of Health. I don't think that is government pushing out the message. I think it all kind of helps to, put it out there. But I will just say that I think that what is really happening, what we're seeing, and this is anecdotal, is that people are starting to have people around them who are actually receiving these vaccine shots and recognizing they're not growing a second head. They aren't, sick for weeks on end. So I would just say that as businesses are thinking through how to address vaccine hesitancy, while you might look to places like local government, health departments, campaigns that are national and social media wise, please make sure to look around you. I'll tell you one story that happened, and Director Swett knows this, that there were not as many, first responders. We heard even from hospitals where there's vaccine hesitancy, even in a healthcare institution like hospitals. So I don't want anybody to feel like they, that it isn't a universal issue at some level, even though those numbers are going down. But we had Sheriff Floyd Bonner that shared a story of how there was vaccine hesitancy with the Sheriff's Department. And he actually himself wanted to learn a little more. It was him getting his doctor to talk to him making his doctor available, having a conversation, him getting the shot. And that led to the numbers going up over there with the Sheriff's Department. So I just want to make sure that while we might be looking elsewhere for others to give us insight on vaccine hesitancy, some of your best inspiration are your frontline employees, leaders of particular organizations and businesses who are themselves demonstrating and leading by example in terms of getting vaccinated.
Excellent thoughts, excellent comments right there. I feel like you're really on the right track with that. Ms. Grant, Director Swett, any final thoughts, any final words you'd like to share with everyone?
No, I just encourage everyone to take advantage. If you have a business and want to participate in either the fast track or the blocks of appointments, please contact those the two numbers. You can always go to the City of Memphis webpage for additional information. I'll make sure that information is sent out today to everyone, to the chamber, so they can get that information out into the community. And just encourage everyone to get the vaccine. There's plenty of opportunity here in our community. We've got the capacity to make sure we get it done. And so I just need your help to push people to get out and get that vaccine.
Fantastic, fantastic. I thank you three all so much for your time, and I'm going to go ahead and send it back to Ms. Grantham. And once again, thank you all so much.
Thank you so much. I'm sorry, I was pressing a whole bunch of buttons there. I put in the, wanted to say thank you so much to Director Swett. Fantastic information. Helen, we are so proud of International Paper. Thank you for spending your time with us today. Bobby, always wonderful to hear what you're keeping your eye on. And Matt, you do such a fantastic job with our Q&A. So thank you all so much for making this webinar fantastic. We've put the numbers to call on our final slide. And we just also thank all of you for joining us today and hope that you'll be able to dial back in on April 22nd for our third and final installment of our webinars. So thank you all so much. Have a wonderful day and appreciate you joining us today.